Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain, and fatigue before I invented ASTR specialty.
Roberto, so tell me what's going on with your knee.
I just went through a total knee replacement
Mhm.
2 weeks ago.
2 weeks ago, and so you had it
Monday
in.
will be 3 weeks.
All right. So how much pain do you feel now in your knee?
3 to 4.
3 to 4. What's difficult for you to do after the surgery?
Bending,
Bending your knees. Okay.
straightening the knee.
Straighten the knee, and okay. So let me see how you bend now. So it's a little stiff here. So almost 90 degrees. How much pain with that?
That was a good, that's about an 8.
Okay, let's try it again. Bending. Straight and bending. Okay. That's 8 out of 10.
That's
Okay.
as much as I can take.
All right. So don't aggravate it, okay? So I will have you lie on your back. I will take the measurement, measure your knee, and we'll work on it, and then we'll measure it afterwards.
Okay.
Okay, and we'll try the same motion. Okay. Okay, so let's actually push your knee down. So he's about minus 15, you see that?
Mm-hmm.
Okay, all right. Bend your knee. Okay. So he's like at 91.
Okay.
Yeah, you see that? Okay.
Yes.
All right. All right. So let's gonna work on it and let me know if that aggravates your symptoms, okay? So this is like 2 to 3 weeks, almost 3 weeks.
Monday will be 3 weeks.
Yeah, after knee surgery, bend your knees. Put this here. Let's pull your short up. Let's pull your short up a little bit. Lift your head up.
Thank you.
Okay.
No, much more comfortable.
So can you tell me what's difficult for you after this and what happened to your back? And so
Yesterday my back yesterday evening, my back starting to hurt on the lower lumbar part, let's say on the right side.
okay, that's because you're limping a little bit.
Probably.
Compensation, yeah, for your knee, and you have a swelling because it's typical. Okay. Okay. So do you feel pain when I do this? Okay, definitely I can feel the swelling.
Yeah.
Make sure it's not painful what I'm doing. Okay.
Mm-hmm.
Okay. So I'm not gonna work on this area, just
Thank
because you have inflammation there. Just gonna loosen up everything around it. And when you bend, where do you feel the tightness? The front, the back, the sides? Like where do you feel the tightness?
On the front,
You feel it right here?
right there, and on the muscles side.
Okay. So gently, I'm gonna use my hand. I'm not gonna use the instrument on the tight area in
Okay.
here, okay? Because you have some inflammation. I will use the instrument on the other part. So you sit in here and here, yeah? Well,
Here, this side here,
this
there's a
side here.
big knot right there.
Big knot, so you have a scar tissue. Okay, let's get rid of that. Okay. So it's gonna feel
Just
cold,
like that.
okay?
Imagine.
Yeah, everything here is magic, okay? Because of the video, okay? Yeah. So we'll work on it. Some patient actually in the first treatment we can break the scar tissue totally. Some other patients take a few treatments. So it depends on the thickness of the scar tissue and their genetic. So hopefully it will be easy with you, okay? You feel that scar tissue here, that knot? Okay. How does feel?
Oh, feels good.
Okay. It feels good, okay?
Oh,
Make sure it's not painful, okay?
well, there is some pain associated with the
Do
pressure.
the same thing on please.
Do you want to do it
Yes.
first? Okay.
You can work with it. Actually, can you use the other table?
flexion? You don't want us to be in the background?
No, you can.
I'm so upset.
Well, how you going? You guys can go. Actually, it's a.
No, I'm joking.
Yeah, that's actually more interesting. Yeah, you guys get the benefit of watching one video. You can do that.
I'm not all that fussy, you know that.
No
guys-
charge to be on camera, eh?
Yeah, it's free. You know.
You got 2 videos.
You're not
I'm serious. If you want to do it there, that's actually fun.
We're just kidding.
All right. Last chance to be famous.
You've already filmed me once.
Yeah. Okay. How does that feel? Make sure it's not painful. Okay. Okay. Too much?
No, it's manageable.
Make sure it's not painful because there is fine line actually between breaking the scar tissue and causing the scar tissue.
Okay.
If you feel pain with the treatment, we might cause more scar tissue. We don't want to do that.
So it's a little sharp.
You know,
You know, it's not a gradual pain, it's a sharp pain when you hit
Those area spots, yeah.
the knot.
Make sure you communicate with me, okay? All right. So I did this, and let me do. Actually, can. Well, while you're here, let me do this. Okay. Make sure that's not painful, okay?
Good. It's just like right at that part, yeah.
That's okay.
All good.
Hmm?
All good.
All right. Okay. Okay. Let's lie on your side, facing this way. Okay. Let's get the pillow between his legs. White pillow. Just-
other side, other side.
Yep. Okay. Gonna work on the back of breaking the scar tissue. Just can rest here. Okay.
We've had such a hot summer, hot winter, and now all of a sudden.
Okay. You have a scar tissue here too. You feel that?
Yes.
Make sure that's not painful, okay?
Need brain.
You have a little like kind of scar here. What's going on? Is it like
It was tested as lichenoid
okay?
dermatitis.
Okay. So it's fine.
Yep.
Okay. How long has this been going on?
Since September.
Sorry, that painful?
Not painful, just
Pressure?
good.
Okay, that's
Yeah,
good.
pressure.
I don't know if you say that when you feel good or pain. I want to know
Not
that.
screaming,
What?
not screaming.
Oh, so that's a feel good sound, okay? That's not the scream, okay? And he's not crying, even though you're not seeing his face, okay? No, not yet. He's not gonna cry, okay? So most of your scar tissue here, actually around your IT band here, you feel that? Okay. Let me actually do deep release and make sure it's not painful, okay?
Okay, so the doctor's on here on Friday. He's only around Tuesday and
Okay.
Thursday. So, I wanna maybe.
Alright, so let's see, where's the tightness? Here. So I'm gonna go deep, okay? Make sure it's not painful.
Get found valid once a week, and then he goes to Irvine once.
So you had physical therapy before?
Other days he's doing.
Prior to come here, yesterday I had my last physical therapy at home.
Okay, what did they do?
They just emphasize on exercise.
No, they did not do anything manual with you?
Let's just call it tickling.
Hmm?
Tickling.
Oh, it's tickling here?
No,
No, he said
that's
let's
what they
call
were
it
doing.
Go ahead and
They
take
were
all
just
the down.
tickling me.
They're tickling.
Oh my gosh,
No
okay.
massage.
Oh, this is called ASTR. Yeah, tickling, that's, well, it's fun, but I don't know if that's treatment, you know? Yeah. Well, it's too expensive to do that with PT. You can do it by yourself. You don't have to pay for the therapy.
And it was very quick.
Yeah. Okay, so you're trying ASTR today, so you'll tell me if that's different than tickling
Very
or...
different.
Okay. We don't tickle here, okay? You can tickle yourself if you want. Even though some patient actually, I had a few patients, they were actually very ticklish in their knee.
Is that right?
Yeah, just touching the knee and they start to laugh. I'm like, I'm glad you're having fun here. So. Well, but we need to have treatment,
That's right.
you know?
Okay, one is for the neurologist.
Is it painful or it's okay?
No,
You feel the deep tightness there?
yeah.
Okay, so I'm gonna release that. Okay.
It's been approved.
I want to release the right hand now.
Please, you could go ahead and
Okay.
make your appointment. Are you ready?
Make sure this is not painful.
714.
So you remember your range of motion before?
Yes.
That's a quiz, okay? How much?
You measure 91.
91 and minus 15.
Minus 15 on the
Okay.
scale, yeah.
Yep. So we're gonna measure it after ASTR treatment and see how you're doing with your range of motion, okay? Is that too much?
Was good.
Okay. That's good.
That's a little pain.
Sorry. Okay.
It's okay. I won't tell you, you don't know.
Yeah, yeah. Just
Pacific Coast, can you please hold? I have to
okay. Pain or it's okay?
It's okay.
Okay.
I can handle.
Yeah, make sure it's not pain. Okay, so let's actually, well, let's feel actually better. Yes. Oh, sorry. Okay. What about now?
Better.
Okay. Okay, let's turn around. I want you to lie on your back. We'll measure it again. You know, because of your swelling, we're not gonna get the 4 range of motion today because
Sure,
that
of
swelling. I'm not sure. We have to. The swelling has to go down to decrease. Okay, push your knee down. Okay, so now it's minus. Let's see. It's minus 10. It was minus 15. Okay. Bend your knee. How does that feel?
That's as much as I can do.
Okay. 101.
Wow.
Yeah, 10 degrees. It's good. Yeah. So let's sit up. Where do you feel the tightness now? When you do that?
Front.
Front where? I want you actually
Right
to
here.
right there. Okay, let's lie in your back. Okay, gonna do with that. I'm gonna work on the here a little bit, very gentle. Okay. Is that painful? It's okay.
It's tender.
You feel that you have a lot of scar tissue here. You feel those bumps.
Mm-hmm.
You actually visually can see it, those scar tissue.
Yeah.
Mm-hmm.
You know. Okay, so this is a sorry. Okay.
Okay.
Okay. So let's actually use it for the other instrument. Okay. Too much or it's okay? Alright. Okay, so let's bend your knee.
Okay, you were like.
Alright.
No, no,
Let's,
really, totally.
bend your knee. Okay, let's do 5 bending, back and forth slide. Okay.
Okay, yeah, this is where the insurance approved your service to be at, so
Your muscle very weak.
I would have to go up to the
Down.
Yeah, we gotta do some strength exercises after this. You counting? If you're not counting, we're gonna do 200, okay?
I probably need to.
Okay. The last one, and I want you to do it and hold it. Okay. 115. I'm sorry, 105. 105 was 91. Okay, straight your knee. Okay, push down. Okay, still like minus 10. Okay, so let's sit up and turn around and get the whole thing with his legs and everything. And kick and bend your knee a little bit and tell me, can you tell the difference? How's that?
Clicking.
Yeah, that's typical. But can you know? Are you able to tell about your range of motion?
No.
Okay. Do you feel any
I-
difference?
Same pain that I had before.
How much from 0 to 10?
I'm still 3 to 4.
Where do you feel it?
All the time here.
All in the front. Okay. So
And clicking in the back.
yeah,
For
that's,
whatever reason.
so that's wrong. Okay. I'm working this. Is that painful what I'm doing here?
No.
Okay. Sure, it's not painful. Toes up, toes up, toes up, Hold it, hold and relax. Sorry.
It's all right.
Okay, try it again and tell me how that feels.
Just give me 1 second. The scheduler is on the phone right now. Helping a patient, so I'll finish the bill.
0 to 10.
Okay, 1 second.
I get 2 to 3 now.
Okay, where do you feel it?
Some pain here and here.
Okay, relax. Make sure that's not painful while I'm doing, okay?
It's painful when you're pushing.
Sure. You know, that's painful, okay? Okay. Try it again. How's that?
Same, I get 2 to 3.
2
But
to 3, and you feel
less
it in the same.
painful than when I first started.
That's beautiful. Okay, where do you feel it now?
Right over here.
Okay.
Probably normally so. I
Hmm?
mean, normally so, I would think. I mean, pain's not gonna go away.
Well, if it's related to your inflammation, no.
Mhm, exactly.
If related to soft tissue, we can work on it to get it down. So I'm just ruling this out to see if it's inflammation, because you can get both knees. You can see how much is swelling, so that's probably from the swelling. But what I care about, as long as you move easily and more like loose, and actually let's get the whole picture. That's a good sign. You know. How does it feel now? You're moving faster.
Much better.
Yeah. So what do you think about ASTR treatment?
I love it.
Yeah.
So far.
Yeah, awesome. Thank
I
you so
love
much.
my first 20 minutes.
Yeah, awesome. Yeah. So you
I'm
get
really looking forward, you
Yeah.
know, what's gonna be, and
yeah.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video with the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.